to the Minister of Health, does he stand by all his recent statements on health services?
The Honourable Tony Ryle.
Yes, including the statement that just before the general election, the Labor government cut over $110 million from public health services, primary care, funding for people with disabling chronic medical conditions, the Diabetes Get Checked program, smoking cessation programs and others over 5 years. It appears the previous government made these changes because despite giving DHBs more resources, the growth in health service demand means DHBs constantly need to move lower priority spending to help deliver improved frontline health services.
The Honourable Ruth Dyson.
Given the increasing number of GPs leaving the country under his watch, and the fact that he has recently changed his mind about closing the wage gap with Australian doctors, can New Zealanders expect to wait longer and longer to see a GP under a national government and pay more for the privilege?
The Honourable Tony Ryle.
Oh, Mr. Speaker, no government has made more efforts than this government to keep doctors in New Zealand. Not only are we funding additional GP training places, the tax cuts announced by the Finance Minister will put substantial money in the pockets of some of our hardest working health staff.
The Honourable Ruth Dyson.
What does he say to Grey Power, who yesterday raised concerns about Meals on Wheels being cut in the Helensville electorate, and who are so distressed about this that they've written to both him and the Prime Minister?
The Honourable Tony Ryle.
Mr. Speaker, I've looked into that case. 8 people in Helensville are receiving Meals on Wheels from a local charitable trust, part funded by the DHB. Everyone else in the area gets home support and meals through the DHB's mainstream support services. The DHB is rolling this small contract for these 8 people into the contract that it provides for the rest of the region, and I'm advised that those people will get the same, if not an improved service.
Dr. Paul Hutchison. Order. 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 Dr. Paul Hutchison.
Thank you, Mr. Speaker. My supplementary is to the Minister of Health. What reports has he seen in relation to improving frontline services in difficult-to-staff areas?
Honourable Tony Ryle.
Mr. Speaker, I'm pleased to announce that the government's voluntary bonding scheme for doctors, nurses and midwives has been oversubscribed for a second year in a row. 500 new health graduates have joined this year's scheme. We now have around 1,400 doctors, nurses and midwives accepted into the scheme, which offers student loan write-offs or cash incentives to stay in New Zealand. This year's intake includes 45 midwives, 392 nurses and 64 doctors. Mr. Speaker, almost half of all the new midwifery graduates have joined the scheme.
The Honourable Ruth Dyson.
Why, when he was warned last year that the Australian government was making changes that would make it easier for New Zealand GPs to work in their country, did he sit back and do nothing? And as a result, 59 rural practices have recorded a shortage of GPs since he became minister, and in the past year, 26 urban practices have recorded shortages.
The Honourable Tony Ryle.
Mr. Speaker, the advice from Health Workforce New Zealand has been that those changes in Australia will have a minimum impact in New Zealand, and I'd like to remind that member of the thousands of New Zealanders who could not get a GP when that member was a Minister of Health.
The Honourable Ruth Dyson.
You're running the show.
Having last week dismissed the concerns of the staff at Wellington Hospital in relation to their increased workload due to imposed annual leave entitlements, what will he now say to the woman who has gone public with the fact that last Thursday at Wellington Hospital her mother was left lying in her own faeces for 3 hours, being unable to get anyone to help her?
Honourable Tony Ryle.
Mr. Speaker, of course that is absolutely unacceptable if that was to happen. That lady is currently under an investigation, and I'm sure that all New Zealanders would be appalled if the nursing staff put her in that position.
Question number 4, Chester Borrows.
Thank you, Mr. Speaker. My